Hello, this is Winchester Wiley with the Franklin School of Nursing. Christina Davis, FNP, is the lead instructor. We're going to understand acne and rosacea in this slide slope presentation. Acne is usually onset as adolescent. It's usually triggered by hormones such as puberty and menstruation. Risk factors are oily skin and their diet. Symptoms are the whiteheads and blackheads, also known as condones. With the example of acne can be papulopustule nodule. Face can exist on the face, chest, and back. It can be erythemas, papulopustule, oily appearance, and possible scarring. The onset for rosacea is, however, later in life in 30 to 50. It's a lot of environmental exposures. The symptoms are very similar to acne, however, they're case dependent, with a centralized rash and red pustules and spider-like veins. Acne is diagnosed clinically in different severities. The purpose is to get rid of the bacteria or the underlying dermoscope of the cause. Rosacea is clinical. It's needs to be differentiated with sebaceous dermatitis. You can do procedures like skin biopsies and laser therapies for telangiectasis. Therapeutics are topical oral meds, pulse dye, and lasers. Lines of therapy: first line therapy is going to be topical for acne. Second line is going to be oral antibiotics, and then nighttime care, of course. Rosacea is going to be metronidazole, low-dose oral doxycycline, education. Basically, this last slide here is really just going over contributing factors for each, like PCOS can cause acne. Rosacea can be from cardiovascular disease, H. pylori. We want to make sure that we don't overuse antibiotics, and then we build up strains that are resistant to them. We also want to make sure we address the patient's quality of life, make sure they're not having self-esteem issues, any kind of social embarrassment. And then alternative therapies are always something to consider. Treatments such as coconut oil to help fix the clogged pores. Lastly, follow-up for acne is going to be 6 to 8 weeks of just therapy and long-term scarring. Rosacea is the follow-up of 4 to 6 weeks. Supported references for dermatological cases provide support groups if needed. Official timelines to see changes anywhere from 0 to 8 weeks. And treatment continuous for 3 to 6, and then long period of maintenance. Lastly is the reference page. I appreciate you all taking the time to listen to this short presentation on the difference between rosacea and acne, and I hope you all have a blessed day. Thank you.